China has been seeing sporadic cluster outbreaks this month. They've been linked to cases in people returning from overseas. Some imported products and their packaging delivered via cold chain have also tested positive. This comes as China says it expects an uptick in logistic services during the winter season.
We're stepping up inspection and disinfection activities at the borders. We've emphasized personal protection for staff working on cold chain logistic chains, and we carry out regular tests for them. For most consumers, the likelihood of infection by purchasing imported cold chain products is pretty low.
China has also been working on building defenses against local transmissions. Over the past 5 months, it has carried out mass vaccinations for those working in transportation, healthcare, wet markets and other high-risk sectors. Chinese officials say the vaccines approved for emergency use have appeared to be relatively safe and can be used for a wider group of people.
We do not recommend getting a COVID-19 vaccine and an HPV vaccine at the same time. It is also not advisable if a person has an allergy to a certain vaccine ingredient. There are other situations where getting a vaccine would be inadvisable. For example, when someone has a fever or an acute disease. In general, we don't recommend vaccination for pregnant women.
The Chinese government says it will also conduct strict supervision over the storage and transportation of vaccines. They've also called for a decrease in public gatherings and advised against non-essential travel. Experts estimate that true herd immunity can only take place once roughly 70% of the population has been immunized. While calling for the general public to get jabs, officials also emphasize that wearing masks, hand washing and other personal preventive measures remain the most effective ways to keep COVID-19 infection away over the winter before immunity can be reached. Yilei, CGTN, Beijing.